Hello, my name is Penda Boma. I am a student of Nightingale College. I'm supposed to be dressed in my scrubs, but for some reason, my uniforms have not yet been delivered. Today I'm going to be performing dressing change using sterile techniques. I have my equipment, clean gloves, my stereo package, some hand sanitizer, and my demo. First things first, I perform hand hygiene before getting into my patient's room. Knock, knock, knock. Wait for the patient to open the door for me. I get in the room. I close the door to provide the patient's privacy. I have no jewelries. I have no nails. I'm going to do the two-step identifiers to make sure we have the right patient by checking their name and the date of birth on their wristband. I'm going to go ahead and perform hand hygiene in front of the patient again, just so they feel comfortable, and then I will explain to them what I'm going to be doing today. Hello sir or ma'am, my name is Penda Boma. I'm going to be your nurse for today. We are going to be performing dressing your wound using sterile techniques. This procedure shouldn't take more than 5 minutes, and I'm going to make sure that it is quick and easy. Thank you for letting me do this process for you. I'll put on my clean gloves. And I'm going to take out the bandage on the wound, making sure it is parallel to the skin so I don't rip no skin off. I'm going to put this bandage in the trash. I'm going to take off my gloves and put them in the trash. I'm going to observe the wound for colors, any smell, and the drainage. I'm going to go ahead and perform hand hygiene. I'm going to grab my stereo package. This is my stereo gloves. I'm going to go ahead and open my stereo gloves, making sure the right side is on the right and the left on the left. I'm going to use the latch to open up my stereo gloves, and I'm going to make sure I stay within the 2 inches on the outside. I will go ahead and grab my stereo gloves by the curb. I am making sure I'm staying on the curb. My thumb went in, making sure you stay on the curb, not touching the glove itself. These gloves are really small, so I'm gonna make it work. I'm staying on the curb. I'm staying on the curb. My gloves are in. I'm going to use my 2 fingers on this one because they are a little bit small, making sure that my thumb is away. I'm going to insert my stereo gloves are on, nice and perfectly fitting. I'm going to grab my cleaning tool with my dirty hand into my clean hand I'm going to clean in a circular motion from inside out. I'm going to put it in the trash. I'm going to grab my balls from my dirty hand to my clean hand, and I'm going to dab the wound from inside out in a circular motion. Put it in the trash. I'm going to grab my band-aid, open this with both hands. I'm going to place my band-aid on the wound. Make sure it's nice and fitting. And then I'm going to go ahead and initial and date the gauze with the time as well, so that I know when this procedure was done. I will put my patient in a comfortable position, provide them with a core light, take off my gloves, put this in the trash, perform hand hygiene, and I will go ahead and document this procedure. This is dressing using sterile technique. Thank you once again. My name is Penda Boma, student of Nightingale College.